Welcome back to Fox News at 4, and thank you for staying with us. You know, this month is Breast Cancer Awareness Month, and today we want to talk about genetic mutations associated with the disease. So as I mentioned, we have brought in the experts to address this. Joining me now to talk more on the topic is Jessa Blunt. She's a certified genetic counselor at USA Mitchell Cancer Institute. Thank you for coming in today.
Thank you. It's a pleasure.
Absolutely. And so this is Breast Cancer Awareness Month. Now's the time where we want to make sure these conversations are going on.
Absolutely, and we certainly want all women to be doing mammograms on an annual basis after or at age 40 and older, but there are certainly women who are higher risk, and there's even men who are at increased risk for male breast cancer. So we want to be able to pinpoint those families so we can get a more aggressive medical management plan in place for them.
Okay, so talk more about genetic testing. First, who's a candidate for that?
Yeah, so whenever we see families where there's young ages of diagnosis, so women being diagnosed before the age of 50 with breast cancer, it's a red flag. When we see multiple generations being affected by breast cancer or even ovarian cancer, when we see triple negative breast cancers, it's a red flag. And then also when we see individuals who have had more than one cancer, so maybe breast cancer as well as uterine cancer, it's an indication that there could be something genetic.
Okay, and I know medicine and testing's always being updated and changed. Have we had any advances for genetic testing?
Yeah, so a couple things that I would love to mention is that there's been a lot of advances in the genetic testing itself. So we now know that there are many genes beyond just what we consider the main genes, the breast cancer or the BRCA genes. Also, because technology has come a long way, genetic testing is now much cheaper. So there's patients who had said, well, my doctor said it would be thousands of dollars. Well, now if we can get it down to maybe hundreds, it's much more accessible to individuals.
Absolutely. I know initially when it first came out, I think a lot of people became more aware of genetic testing after Angelina Jolie went through her experience. And one of the things a lot of people talked about was the cost. So that's good that it has gone down a bit.
Yes, absolutely.
Okay. And also, what are the options, I guess, in terms of treatment? It really differs on the person.
It does. So our goal is always to catch an individual who's at high risk before they're ever diagnosed with cancer. And in those cases, we can maybe intervene with increased screening. So sometimes women should be getting breast MRIs in addition to their mammograms. Sometimes we have what we call chemoprevention. So it's not your traditional chemotherapy, but it's a pill we can take to help reduce our risk for getting breast cancer. And for those who want to go even maybe more aggressive, there's always the option of surgery. So if they're deemed at high risk, then we can talk about preventative surgeries. And now that's a big surgery, but it's also weighing the pros and cons of that risk with breast cancer.
And as you touched on, it's not just women, it's guys too.
Yes, yes. So general population, men can get breast cancer as well, but it's about 1%. And then in these families where there's certain mutations, we can see that climb to around 6 to 10%. So something that men need to be aware of.
All right, and so this is the time where you are encouraged to talk about it and go in, obviously, for that testing, and all of this is available at Mitchell.
Absolutely.
All right, thank you so much for stopping in.
Well.
And you know, we'll have all of this information posted for you on fox10tv.com, so you can watch it again in case you missed anything or share it with someone you know. Jessa, again, thank you for coming by.
Yes, thank you for having me.